Okay. Hello and welcome to our webinar on the 2020 Census and COVID-19 implications for the community panel discussion. This is the first in a series of webinars aimed at cities and regions in the post-coronavirus era, initiating community conversations on what lessons we can learn from this and how to create a more resilient and sustainable world. My name is Katie Phillips and I am the Outreach Coordinator at the Center for Urban and Regional Analysis, otherwise known as CURA. I will be your host and I will be monitoring any questions our attendees have in the Q&A box. If you have any questions following this event, please feel free to email me at phillips.1870@osu.edu. I am going to kick it over to our moderator for this event, CURA's Director, Harvey Miller.
Okay, hello everybody. Happy Friday and welcome to the first in our series of events on cities and regions in the post-coronavirus era. Today we will talk about the impacts, the implications for the 2020 census, the implications for communities from COVID-19. I just want to say that this is the first in a series of events on cities and regions in the post-coronavirus era. On June 12th, we will have another webinar, which will be on the economic impacts of COVID-19. That will feature panelists Bill Lafayette for Regionomics, Jennifer Clark from City Regional Planning at Ohio State, and Eddie Pauline from the Corporate Engagement Office at OSU. And that will be June 12th. In July, we're organizing another webinar on COVID-19 and social equity, and we're still finalizing the panelists for that, so stay tuned. As always, check cura.osu.edu. You can sign up for our newsletter there, so you'll never miss any events. Also, like us on Facebook, follow us on Twitter and Instagram. And if you have any ideas for other topics you'd like us to cover in this webinar series, please email Katie Phillips, phillips.1870, or miller.81. There's also an email link at our webpage, and you can submit topics and suggestions there. So let's get started on today's webinar, the 2020 Census and COVID-19 implications for communities. And we have a really great panel here. I'll introduce them in the order in which they'll give their opening remarks. Aaron Schill. Aaron Schill oversees the Mid-Ohio Regional Planning Commission's Data and Mapping Department, drawing on his expertise in community and demographic data analysis and research methodology, GIS, land use, and transportation planning. Schill leads MORPC's work on data analytics and visualization processes, including GIS. His team supports the data and mapping needs for the rest of the agency, all the members of MORPC, and the broader Central Ohio region. Thank you for joining us today, Aaron.
Glad to be here.
Thank you. Our next speaker is Glennon Sweeney, and she's a senior research associate at the Kirwan Institute for the Study of Race and Ethnicity, and she works in the Community Assessment and Metropolitan Change Unit. She joined Kirwan in 2011, and in 2014, she began to lead the Institute's food justice work. Her work focuses on issues related to food security and access, metropolitan neighborhood change, housing, civic engagement, equity, and the intersection of jurisdictional fragmentation and social service delivery. Interesting topic. She is a member of the Franklin County Local Food Council and the Worthington Community Relations Commission. Glennon holds a bachelor's in geography, yay, and political science, a master's in city regional planning, and she is currently working on her PhD in city regional planning. Glennon, thanks for joining us today. Last but not least is Josh Sadvari, who is the Geospatial Librarian for The Ohio State University. In this role, Josh is responsible for developing and delivering educational activities to support the use of geographic information systems, GIS in research and teaching, and he also acts as a project consultant for faculty, staff, and students from all disciplines who are working with geospatial data, methods, and tools. Through his work, Josh saves researchers time, and I can attest to this, he does, saves researchers time by connecting them with appropriate geospatial information resources at their point of need and helps them to effectively use GIS in impactful ways in their scholarship. Josh, thanks for joining us. Okay, so we're gonna have the panelists each give just a short opening remarks in the order in which I introduce them, and then I'll ask them some questions, and towards the end of this hour, Katie will be moderating questions from the audience. So Aaron, please.
Great, thank you. Hello, everyone, and hopefully you're enjoying this rainy Friday morning. Just a brief introduction to MORPC before I jump into some of our work with census information that will hopefully provide some background to our conversation. For those that aren't as familiar with MORPC, the Mid-Ohio Regional Planning Commission, we're an association of local governments in Central Ohio, made up of about 75 local government members that include counties, cities, villages, townships, and some other assorted levels of government. Our focuses are in generally regional collaboration, but more specifically, we work in transportation planning and are responsible for distributing federal transportation dollars to local government projects. You may know our work also in sustainability, and as we've taken the lead role in that for a few decades now, as well as regional growth strategies. So that looks at land use, at population and development growth, demographics and other related topics, and an increasing focus on housing and housing needs in the region, especially the last couple of years. So that's just a very, very brief overview of kind of the range of things that we work on. I generally say if it's related to planning or development in Central Ohio, we are likely working on it or partnering with folks who are. When it comes to the census at MORPC, we make use of a wide range of census products in our planning work and to support the work of our local members. So even if we're not working with it specifically, we're often that point of contact because we work with census data so often. Folks often reach out to us for some advice or access to data. So just to give an idea of the types of things we work with, a lot of folks are familiar with the American Community Survey. That is probably the most frequent. But we also work with the Population Estimates Program, the Longitudinal Employer Household Dynamic Data, which looks at commuting patterns, where people live and work. And similarly, the Census Transportation Planning Product Program, which is a mouthful. That's just to name a few. There are others, Building Permit Program and other, several other data sets and programs that are all part of the Census Bureau that we work with on a regular basis. But right now, we're all pretty focused on the decennial census, and rightly so, because not only is it the full count of our population, but it also serves as the base for almost all of those other data sets that I just mentioned, as well as a lot of our own work in data, our demographic work, our projections, and development of long-range population and employment forecasts. That decennial data is really the anchor point to which all of those other things are tied. So if we don't have good data right now and we're not really focused on this, it has rippling impacts for our work for the next 10 years to come. And just to close that overview, I would say that it's not an exaggeration to say that we at MORPC, and my team in particular, work with and rely on census data every single day. We are always working with this data, and it is absolutely vital to the work that we do and our supports for the region. And I'll give a quick plug for the resources that we have and make available on our open data site called MOOD. It's Mid-Ohio Open Data, and you can get there at morpc.org/data. And I will reference that later because we're going to be making a resource available specific to the decennial census that we want to direct people to.
Great, thank you very much, Aaron. Glennon, please.
Hi, folks. So for those who don't know, the Kerwin Institute is a interdisciplinary research institute here at Ohio State that focuses on issues related to race, ethnicity, identity, and inequality would be a good way of probably describing what we do. And we do, like Aaron said, we use census data a lot. It is fundamental, and it's really fundamental to our original kind of delving into GIS, which was the creation of our opportunity mapping. So census data forms the basis for that. Generally, American Community Surveys, just as Aaron said, the decennial census has become less relevant to us, actually, as we transition to the shorter form. Now that, for those of you that have taken the census, you might have wondered why it was so short. Or maybe you didn't, maybe you don't work with data, but I was appalled because, the generally has a lower error rate, and the American Community Survey is a sample, and so the error rate is higher. And so, right now, one of my biggest concerns in terms of equity is actually representation in the decennial census, because we want to correct error rates also in terms of our population. And, you know, with the current political climate, I'm very concerned about immigrant populations and their representation in the census anyways, because of the political circumstances in our country right now. And then you double that with this COVID crisis. And I'm very concerned about the error rate that we'll have in the decennial census. And so in terms of equity, that's really my concern with the census. And from a researcher's perspective too, as a researcher, if I was going to survey every single person in the country once every 10 years, I would ask them many more questions personally. But that's probably a good opening for me.
Thank you very much, Glennon. Josh.
Hi, everyone. As Harvey said, I'm the Geospatial Information Librarian at OSU, so my work with the census is usually in the context of research support. There are researchers with varying levels of experience with census data from disciplines all across Ohio State who are making use of the demographic, socioeconomic, other data that is collected and made available through census programs. So in many cases, I am understanding what those researchers' needs are and helping them to locate and acquire the most appropriate census data based on their research questions. I would also say that census data are used in many cases in conjunction with spatial analysis. And so my role in that is to help people brainstorm the ways that they will carry out those analyses, what types of analyses would be the most appropriate, helping them find the relevant boundary data as the Census Bureau updates that so that they can be conducting their analysis at an appropriate scale with appropriate boundaries, particularly if they're looking at comparisons across time. And so the way I would sum it up is that for me, I often think of census data as kind of capital C census data, which is the decennial census years, and then little c census data, which is data that the Census Bureau is collecting and making available from about 130 other programs that they conduct. And as Glennon and Aaron have both alluded to, in my experience, it's really that little c census data that is more relevant currently. When I'm seeing researchers use decennial census data, it's for long-term historical comparisons. For example, there's a resource called the National Historical Geographic Information System that has census data all the way back to 1790 when the first census was conducted. So for current issues, the American Community Survey is probably what I see used the most. For historical projects, the decennial census, particularly the long form questions, seem to be really relevant.
Okay, thank you, everyone. Appreciate your opening remarks. So we'll jump into some questions now, and I'm going to ask a very general question for the entire panel. What are some ways that the census affects the administrative, economic, and political processes in the region? Sounds like a good place to start with you, Aaron.
Okay, now I'm off mute. Okay,
Yes.
so there are a few, I'm going to summarize a few kind of high-level things. I'll dive into a couple of details, but I want to, I know Glennon and Josh are also going to touch on some of these same topics. So redistricting is one we hear all the time. That's one of the primary uses. But redistricting is not just, so we hear about congressional redistricting, and Ohio may be losing a census or a congressional seat, and if that happens, we want to keep that to one and not have the possibility of losing more than one. But what I like to emphasize is that's also really critical for state and even local city council legislative districts. So this affects our representation at every level of government. I was the city planner at the city of Newark in 2010 when the census occurred, and I was a staff person assigned to work with the redistricting committee for city council wards. So if this seems like a really big thing that doesn't affect you on a daily basis, if you live in a community that has wards, there's a good chance that your city council person, who maybe lives a couple blocks away, is your council person because they were put in that ward. Those wards were created based on decennial census data. So this really gets down to the very, very hyperlocal level. Similarly, funding at a state level, $33 billion are allocated to the state of Ohio annually using census data. And we think about these kind of big programs, community development block grant program or entitlement programs like Medicaid that we hear a lot about. But if you have federal student loans, if you like driving on roads or using bike trails, If you work for a company that recently got a loan through the SBA or USDA or other business loan or grant programs, those are all the funding for all of those programs, and dozens more are allocated by the Census Bureau. And then Bill touched on how we use that data on a daily basis also.
Great. Glennon.
Yeah, I mean, I think Aaron did a great job of really highlighting what is important. I would say that also significantly nonprofit organizations actually utilize census data a lot to justify their services. It's publicly available data. And so it's really important when they're making funding requests to private and public funders, including government entities, to be able to say, these are the number of people who are low income, or these are the people we're serving, and this is the proportion of people we're serving out of the people in the neighborhood, right? And so these things really matter, and this is one of the few sources of open, reliable data that organizations like this have. And the nonprofit section, I would argue, really significantly influences political and economic processes in a region as well. But that's really, I mean, I think Aaron did a great job otherwise covering that.
Well, let me twist this question a little bit for you, Josh. Since your role at a university as a geospatial librarian, what do you see as, tell us about the role of the census in doing research on these topics, on the administrative, economic, political processes. How does this impact your ability to get your job done and to help researchers?
Well, so it's important that, as Glennon and Aaron have both alluded to earlier, that the researchers understand just what they're getting with these data products, the error rates that come with the ACS versus the decennial census, the kinds of questions that could be answered with the census as one data source, potentially among many, that would be useful to them, and particularly now when we think about the current COVID-19 crisis, I wanted to mention, in addition to Census 2020 data collection, which is happening right now, the Census Bureau is conducting two what they're calling experimental data products. They're calling them the pulse surveys right now for about the next 90 days. And one of them is the household pulse survey, which is asking questions about things like employment status, spending patterns, food security, physical and mental health, access to health care, things that are meant to inform state and federal government responses, continued recovery efforts that will have administrative and economic impacts in Ohio. And those data will soon be made publicly available and I think updated on a weekly basis. And then the second one is the Small Business Pulse Survey, which is also happening right now and is focused on specifically the impacts of the pandemic on small businesses, what the effectiveness of programs like the Payment Protection Program has been, and that data will be made available by sector, by state, and for the 50 largest MSAs, Metropolitan Statistical Areas, which will include Columbus. So not just for public agencies to make use of those data and understand the recovery environment, but could be valuable data sources to researchers as well. And like I said, I work with researchers with varying levels of experience, and for many people new to the census, they know of the decennial census, they know of the ACS, they're not as familiar with all the other potential data products that the census might be providing them.
Oh no, I'm sure many in our audience were not familiar with that, so thank you. Okay, another question. No, we are right in the middle of a public health crisis, the COVID-19 crisis, which is having a big impact on our society. Tell us how census data can be used to do research and action in a crisis, both during a crisis like this, but also in the recovery and looking out further beyond the crisis. Glennon, do you want to take that first?
So can you repeat that question, Harvey?
Yes, I'm asking about the use of census data to address public health problems, both chronic and acute. And really, I frame that in the sense of right now we're going through a major public health crisis, and I'd like to know how is census data used to help respond to a crisis like this and mitigate its impacts and move beyond the crisis. I wonder if you could just comment very generally about that, and especially about some of the social equity issues surrounding this crisis, which I know is a concern of yours at Kerwin.
There are two main ways. So like the social determinants of health, right? These are critical to understanding public health. And and addressing public health issues, right? And so a lot of that is coming from ACS, that long form census, the American Community Survey, these samples, right? And that's really critical in terms of understanding what's going on in communities and addressing crises at the local level. Census data also provides the denominator, though, in calculating like disease rates and things like that within certain geographies as well. So having population counts matters in terms of understanding the rates of infection for diseases and things like that. And it probably helps. I don't do modeling, but I'm sure that this data is helping people who are creating models. But, you know, with the census, is the decennial census, though, the switch to the short form there does, I don't know, it's still, I'm still very uncomfortable with that. I think that it's going to lead to more errors, especially this year with everything going on. But generally speaking, the census isn't collecting primary health data, like disease rates and things like that. You're going to be getting that from the CDC, public health departments, and places like that. And so it's going to take a variety of data sets to fully understand and address these public health crises. But CDC really, so things like infant mortality, life expectancy, who's at risk, things like that. I mean, you know, my colleagues who are doing the public health work, I think Mick Young might even be on this call, Mick Young Beck, who's a colleague of mine, they're going to CDC, they're going to other places to really understand those dynamics.
Sure, but how can census data be used to understand some of the impacts of the crisis and some of the differential impacts? I wonder if you can comment on that.
This is the social determinants of health, though, right? Understanding the way that other community issues influence health, right? Unemployment rates, educational attainment, all of these other indicators, really a lot of the indicators that we use in our opportunity mapping and understanding conditions within communities and disparities across geographic space. That data is critical, and we're getting a lot of that from the American Community Survey. And some of it too, and the economic is probably coming from business analysts and other places like that through Esri, but that data is really critical in understanding what's going on and the conditions in communities.
Josh, what do you see? We know that when it comes to public health, there's a tight coupling between research and action. So what have you been seeing recently in this crisis, and also just over the longer term? How are public health researchers using census data, and what's its value to them?
Yeah, so just to quickly piggyback off of what Glennon was saying related to the social determinants of health, for anyone who may have seen mention of something called the Social Vulnerability Index from the CDC, that is something I've seen quite commonly mentioned in the context of COVID-19, and that essentially relies on primarily ACS data that Glennon was talking about. So if you're seeing that metric, you're seeing the results of a compilation of different census data. More generally, the ways that I have mostly seen public health researchers using census data couples pretty tightly with the ways that they're using spatial analysis. So when you think about things like for disease modeling, you're looking at, if you're asking a question like how and why does a particular condition, chronic or acute, is distributed in a certain way, or how does it cluster spatially, you're looking at things like what's the distribution of the population, what are the risk factors associated with that condition, and what's the distribution of the population with those risk factors. So for example, early on in COVID-19, the main risk factor that a lot of people were talking about was age, and so the inquiries I was getting were, what's the age distribution, and how are we pulling that from the latest ACS. Another example is modeling environmental exposure. So in general, if you're asking what populations are geographically at risk to certain environmental factors like air pollution or a lack of walkability to impact their physical activity and potentially things like obesity, diabetes, what's the built environment look like that creates those exposures and who's most geographically at risk? For COVID-19, we might be thinking about population density, employment density, public transportation networks, where are populations potentially going to be most likely to be exposed as our economy gradually opens back up. And then lastly, and this has been a big one with COVID-19, how do you model healthcare access? So where are the facilities located? what populations can or cannot readily access them. This was, if you think about COVID-19 and hospital bed capacity, this was something that the geographic dispersion of the population, the at-risk population in relation to those facilities, was really important to understand to be able to flatten the curve, as they say.
Great.
So Harvey, before we move on, we have a quick question from the audience.
Okay.
There's been some recent articles talking about the use of statistical noise to alter data to avoid privacy issues. Can you explain what this is?
Who'd like to take that?
So I will jump in. I know several of us are going to want to mention this. So I'm going to say 2 words in a moment, and I think there are 2 types of people in the world. There are people who are going to get really riled up and either be excited or very angry, and then there are folks who won't know what we're talking about or are a little bit less enthused. Not a value judgment, but this is a very divisive issue. So differential privacy is that issue. I think we can come back to that because we're going to talk a little bit later about some concerns about skewed data or geographic representation in the data, and that's really important. But this is absolutely something we need to be talking about and concerned about for the reliability of the 2010 census data and other census product, or 2020 census data and other census products going forward. And I'll let Glennon and Josh also react to that.
Either one. Who wants to go next? Josh, are you familiar with this? Introducing noise into census data for privacy protection?
Yeah, so I would say that the current way that the Census Bureau is approaching this, you know, the census data will never be more private in terms of anonymity of responses than they're meant to be in 2020. And the reality of the situation is the Census Bureau is bound by law to keep your responses private, anonymous, confidential. The problem is that in this new big data environment where there are many other sources that are making our data collected from cell phones and Facebook and online clicks, you know, all that stuff aggregated at a respondent level when theoretically combined with census data can lead to potential identification of individual respondents. So that becomes problematic. It's equally problematic if the data are randomized in such a way that their purpose in these really fundamental things like redistricting and funding becomes less accurate and realistic. And in what I've read about this, it looks like the effects are the most pronounced in communities that are have the least population. So you could see a community that in 2010 had a very small population. Because of the randomization that happens, it jumps up to 5-10 times that population. That becomes an issue, and I don't think the Census Bureau has adequately addressed it yet. They know from researchers that this is an issue. They had a group of experts go in and analyze these data and raise concerns. We haven't seen what the outcomes of that are going to be yet in terms of ensuring both privacy and, you know, use for all of the purposes that the census data is meant to be used for.
Right, and I can imagine this would have a differential impact on different populations and our measures of them. Okay, Glennon, do you have anything to add? No? Okay, we can move on.
So I would say,
sorry,
I do want to
ahead,
touch more specifically the issues that exist. So Josh is absolutely right. The concern about big data and being able to track back to individuals is a concern. What was shown in the Census Bureau's tests of that is that the vast majority of the data sets that they used, you would actually have to already have the Census Bureau's data about an individual to then be able to essentially retrace your steps and identify folks. So I think one of the concerns is the way that they went about that process and testing is not a real world scenario where, so I think it overinflated the concern about people's privacy being compromised. And the way differential privacy is being applied right now, the plan is to apply it separately to housing units and to population. So by applying those separately with no connection between them, for any given tract or any given block group, one could be introduce noise to bring the number up and the other could go down or vice versa. And so what has been seen in the test is some wildly varying results. So if housing units is adjusted down and population is adjusted up. There were some examples where block groups in other states were seeing occupancy rates of 22 people per housing unit, as an example, once differential privacy was applied.
Wow.
So to that point, it essentially makes that data unusable. We know that a lot of these concerns have been raised, and there have been a number of instances where this so unlikely as to be impossible outcomes are occurring that it raises real concerns with the viability of the data. We know that the Census Bureau's plan is to move forward with it, so they're not looking at alternatives, but we're hoping that they're taking input on how to adjust those differential privacy measures in a way that that does protect privacy, but ensures that the data is going to be reliable, because the plan is to roll it out with ACS and other data sets following the 2020 census also.
Okay, thank you. That was a good question from the audience. Any other questions, Katie, right now? Okay, then we'll move on to my next question. This one's actually directed at Aaron, so don't turn your mic off yet, Aaron. How's the response rate for Central Ohio looking compared to 2010? Can you talk about that?
Yeah, so the short answer is it is really hard to compare response rates now to 2010 for a few reasons. The only data that's available is comparing our current progress, where we are right now, to the final 2010 response rate, or 2010 response rate. So it's debatable how useful that comparison is, because we're right in the middle of collecting data. Internet response was not widely available. So there actually were internet response options before 2020, but it wasn't widely available. So just the way we're collecting data is very different this time. Additionally, geographies have changed. So city and jurisdictional boundaries have expanded through annexation, and census tracts have changed. And so we're looking at the proposed 2020 census tract. So the geographies aren't completely comparable. And then of course we have this COVID-19 issue, which we didn't have in 2010. So for that reason, I wouldn't suggest comparing so much to 2010 as looking at how are we doing in Central Ohio compared to our neighbors, to other states, to other communities, and trying to kind of get a sense of how is our response rate looking in comparison to the rest of the US. So right now, Ohio ranks, as of the latest data, which is Wednesday of this week, Ohio ranks 7th among states with about 63% of households responding. 8 of the 10 top states are in the Midwest. So there's something about the Midwest where we're good at, we follow directions or something, because 8 of the top 10 response states, some of which are over 70%, which is really great at this point. They're either meeting or exceeding their 2010 final response, which is a good sign. In Central Ohio, Delaware and Union counties are the only 2 states that are the only 2 counties in Ohio of the 88 counties that are in the top 10. They both have response rates over 70%. It's not surprising to see suburban, more affluent counties with higher response rates. We expect to see that. Franklin County has a response rate of 59%, which is 62nd in the state. That's relatively close to Hamilton and Cuyahoga counties. So all the very large urban counties are kind of about in the same space. And within Franklin County, the OSU campus area, which I think we're going to talk about a little bit more with student response specifically, but some of the tracts around OSU are the lowest in the county, which is certainly a cause for concern and to pay attention to. And then a number of the underrepresented neighborhoods in Franklin County in those tracts. So when we think about any maps of inequity, poverty, educational attainment, health outcomes, we think you can draw a line down I-71 and across I-70, and folks south of I-70 and east of I-71 live in those underrepresented and historically underinvested neighborhoods, and we see lower response rates there. What's really concerning in those neighborhoods in particular is that the internet response rate, so we can see total response and internet response. The internet response rate in those tracts is as low as 50% or even under 50% of total responses in some of those areas, compared to some of the more affluent tracts in Central Ohio where the internet response makes up over 90% of responses. So this is highlighting an internet access issue that may cause folks to struggle to respond and may cause underrepresentation of those already historically underrepresented neighborhoods.
And that's a great segue into the next question I was going to ask about hard to count populations, such as the homeless, immigrant populations. You mentioned people without internet access, or there was a question from someone in the audience about college students. So can you talk a bit about that? How does COVID-19 affecting that, these hard to count populations?
I'm gonna touch on a couple of the procedural changes that are happening right now that we're dealing with because of COVID-19, and I'll let Glennon and Josh talk about some of the impacts and what we're seeing in the actual responses. So procedurally, the Census Bureau, just like everybody else, is impacted by COVID-19, and there have been closures. The field offices across the country have been closed since March, like everyone else. Theoretically, people can still respond in any of the three ways that you've been able to. So online, by phone, or by mail. Theoretically, that's still possible, but we know that in reality, coronavirus and other things are impacting that. So the changes that have occurred is, or the plans going forward are for field offices to open June 1st. And I'll give the caveat that all of this is subject to change like everything else right now. But the plan is for field offices to open June 1st. For counting of some of these special populations to begin right away after June 1st. So that includes the homeless counts, which have been put on hold. Those are a completely separate process from the household counts. Group quarters counting will begin more in earnest. Some of that has been occurring by administrative records, but more outreach for group quarters will happen right away starting in June. And then the plan for non-response follow-up, essentially when folks go out and knock doors in neighborhoods and reach out to those households that haven't responded yet. That is planned to start back in August. But that is all subject to social distancing and other guidelines, whether that's possible to happen. And this ultimately is looking to push back some of the statutory delivery dates. So the Census Bureau has asked Congress for a change to the dates that apportionments would be delivered to the president and to Congress. They're asking for a 120-day delay on that, as well as a 120-day delay on delivering the redistricting data to states, and that's still awaiting approval.
Glennon, do you have any comments on that? Hard to count populations and the impacts?
Yeah, so I think that, when we do get to the in-person enumeration, I think that, that the pandemic is probably going to impact where that can happen, and and depending on where there are outbreaks, and that so I think that the impacts will be different across the country depending on where the outbreaks and the virus is more prevalent. But I think it's really going to be very difficult for particularly homeless, but other hard to count populations as well. And in some projections with the virus, they're saying that rural America is going to get hit later. If that coincides with when we're doing in-person enumeration, then you're going to look at even lower counts in rural populations, particularly rural minority populations that tend to have trouble. Anyways, African-American, Hispanic populations, Native American, in getting those counts. And then also I'll just reiterate that the overall political climate right now, I think makes a challenge for immigrant populations, particularly Hispanic and Middle Eastern, from Spanish-speaking and Middle Eastern countries. I think that those populations will be much more hesitant to participate and harder to find than normal, which, for the kind of work that we do at Kerwin, that makes our work all the more difficult if we don't have accurate census data to work with.
Josh, what about this college student thing? I mean, that's important, and I'm sure you've been thinking about that.
Yeah, and I saw there was a question that came in about the fact that Census Day, April 1st, happened while Ohio State and many other universities had sent their students home. So two main points here. The first one is that the census guidance is pretty clear that students should be counted according to where they live and sleep most of the time, even if they are physically located somewhere else on April 1st. So if you're a university student who normally lives at your university rather than with your parents or somewhere else, you should be counted at your university, regardless of where you're responding from. The second main point is that when you're thinking about college students and the census writ large, and particularly in 2020, there's really two different populations that we're talking about. The first population of students are those that live on campus or in university-owned housing, like dorms, who are technically counted as part of the group quarters population that Aaron mentioned. And I saw there was another question about nursing homes and other group quarters facilities. That's the same sort of thing. College dorms fit into that. And the guidance from the census on that is that, technically those students shouldn't have to do anything. The Census Bureau is working with university housing administrators to ensure that those students are counted as part of the group quarters population. The second group of students are those that live off campus, and those students do need to respond themselves under the guidance that they should respond where they live at their university. They can use online, phone, mail, just like everybody else. And they're supposed to, if they live with roommates, they should include their roommates' information as part of their response. And the guidance on this has been from the Census Bureau that they'd rather have duplicate responses from multiple roommates who live at the same address than no response at all for that address. And they have deduplication techniques on their end that they can address that. But if you're a student who lives off campus, make sure you respond with your campus information, your roommate information. I think the big challenge with this right now is communication. To what extent is this guidance being communicated to university students? The Census Bureau has asked university housing administrators to remind their students about the census. To what extent is that happening? To what extent are they making this guidance clear? And then, as others have touched on, just lower response rates among college students in general could be an ongoing challenge, and we'll see how that plays out once census enumerators are able to go out, whether or not Ohio State students are back in class in the fall, or whether or not they have to follow this guidance to respond from somewhere else.
So this may seem like an obvious question, but I think it's worth exploring. What biases will all this introduce into the census?
So the big bias that I think I've seen people concerned with in terms of community funding implications and in university students in particular comes when you think about large universities that themselves are not located in a large metro area. So this includes a number of our Big Ten peers: Penn State, Michigan, Illinois, Indiana, others. So thinking about Penn State in particular, the main University Park campus of Penn State in fall of 2019 had about 47,000 students. It's located in Center County, Pennsylvania, not far from where I grew up, which has a population of 161,000. So those students account for about 30% of the county population. If you look at Ohio State, 61,000 students in the fall in a county of approximately 1.3 million, that's roughly 5%. That's a huge difference. Any undercount is a major issue. It affects all of us, our entire community. But to have 30% of your population potentially be at risk of being undercounted versus 5%, that's a really significant challenge for universities that are not in large metro settings. And similarly to what Glennon said, rural populations, other already hard to count populations are going to be affected by this too.
Right, and I want to segue that question and open it up a little broader for Glennon and Aaron. I mean, what about other hard to count populations? What will be the biases introduced? What will be the implications? Like rural versus urban, different parts of the country. I mean, we're going to see biases based upon counting, for example, populations in the Southwest versus the Midwest versus the Southeast. Tell us about some of those biases that may be affected, that may be introduced.
This is a question that we've been dealing with in almost every aspect of our work right now. In the regional housing strategy we're working on, we're thinking about how do we change our approach, or how do we think about the housing data we're analyzing and potential solutions and housing needs differently due to COVID-19. How do we think about transportation and transit differently? I think there's a lot of unknowns, right? We just don't know yet. We don't know how long some of these measures are going to be in place. We don't know what reopening or the quote unquote getting back to normal looks like. I think we all acknowledge a lot of unknown. The thing that I think we've all agreed on that is unknown is that vulnerable populations, which are in census terms hard to count populations, are disproportionately affected when we deal with large societal issues like this. So the risk of undercounting, the risk of geographic bias is exacerbated for those vulnerable populations everyone is affected, but they are affected disproportionately. And so issues like internet access, we were already concerned about low-income neighborhoods with poor internet access and rural communities with poor internet access, and how we were going to ensure they were adequately counted, particularly when doing the census gets easier if you have internet access. And so higher income areas may see substantially better response rates than in the past. So there's the potential there to exacerbate an already existing equity disparity that exists. So that's one of the knowns, is that those issues are going to be exacerbated, and internet access in particular, if folks can't go door to door and close the gap by doing in-person non-response follow-up, where internet access is a real challenge. I think that presents a real concern for geographic bias and overrepresentation of folks where internet is pretty ubiquitous and affordable to people, and significant underrepresentation in areas where it's not.
Glennon, would you like to add something?
I 100% agree with what Aaron just said. That's my big concern is in terms of who has access to being able to answer. And then in terms of when we do in-person enumeration, I'd also just reiterate that, you know, I think that it's going to be geographically uneven depending on where there are outbreaks, right? And there might be places, and they could be big cities even, where there's a big outbreak and we can't do the in-person enumeration the way that we need to get those population counts. And those big cities are usually more diverse. It could be in a rural space. It could be in both rural and urban spaces in different places in the country. So I think it's going to be really interesting, is one way of saying, to see kind of how it plays out, because as Aaron said, there are a lot of unknowns right now.
Are there ways of dealing with these biases? Oh, sorry, go ahead.
Yeah, I also want to raise one other consideration. You know, as we were kind of preparing for our call today and talking about some of these topics we want to cover, I was thinking back to a year ago and the quaint problems of a year ago, like what about the citizenship question and people being concerned about how the government will use their data? Like that seems like such a nice challenge to have compared to what we're talking about now. But that problem hasn't gone away, right? Like there were concerns about how concerned people would be about the use of their data and privacy and trust in the government, and a whole bunch of other hurdles that we were preparing to deal with as the census rolled out. And those haven't gone away, but it's easy to overlook them because we're talking about this current unprecedented challenge. So these things layer on top of each other and they all exist as well. So there's still, when we talk about concerns about bias or undercounting, there's still a concern for immigrant and non-English speaking households, for a number of reasons, being hesitant to respond. And so I think it's important that we keep in mind that all of those challenges that we were talking about in the months leading up to the rollout of the census are still in play as well, and we need to be figuring out how to deal with those in addition to the new stuff.
So are there any ways of dealing with these biases ex post facto? You know, I mean, again, we're stuck with these counts probably politically, but in doing research, and maybe this is directed at Josh as well as Aaron and Glennon as well, can we measure these biases and take them into account when we do research with census data? What methods exist for that? Or is it just we're stuck?
So the Census Bureau does release information after the fact about what their estimates are in terms of which communities may have been undercounted or overcounted. My hope is that some of the deduplication procedures they're talking about for this year with, you know, roommate responses might also be used to address, well, what if a college student responded from their home versus from where they would normally live? You know, so I don't necessarily know the answer to that question other than to say that the Census Bureau has techniques that they try to deal with this. They release information afterwards about total undercount, total overcount. I think in 2010, it was like a 0.1% total overcount is what they had predicted, but that affected populations differently. White populations were overcounted. Black and Hispanic populations were estimated to have been undercounted, just like we've been talking about already, and that could be exacerbated this year. But the baseline information, I think, then becomes what is the Census Bureau estimating as the total overcount or total undercount, and then how does that plus the normal error rate get get modeled in your statistical analysis.
Right.
Yeah, I think that's true. I will also say there are those other census programs I mentioned. While they do rely on the decennial census for how they do their sampling, we have the population estimates program, which is an annual program. So we get updated population data annually from the Census Bureau that they're estimating based on not just decennial census data, but building permits and other activity. I completely agree with Glennon about a lot of the concerns with transitioning from the long form to the ACS. One of the good things about the ACS is it's a continuous survey. So we're not stuck with data from once every 10 years. We're seeing that data continue to be updated. And so that hopefully can help to, if not correct for, at least shed some light on where some of those issues might exist with the decennial census data.
Okay, great, thank you. So we're in our last 10 minutes. So if anyone in the audience would like to ask a question, please put it into the Q&A window, and we'll give it to the panelists. Let me ask a speculative question. We're waiting for some audience questions. So can you imagine, what can you imagine for the 2030 census? How will we do things differently 10 years from now? I mean, Aaron, you mentioned things like big data, and there's private sector sources of data which has high temporal and spatial resolution. Can we reinvent the way we do the census to do it better and to eliminate some of these problems and biases? I mean, what can we learn for collecting census data from this crisis? Who'd like to?
Well, I think we're already seeing increased use of administrative data by the Census Bureau, predominantly for group quarters counts right now. So going into the Census Bureau, colleges actually had several options for how to count population in dorms, including sending the survey to every student in dorms. Since the stay-in-place orders and coronavirus, they essentially transitioned to strictly using administrative records every place possible. So they essentially eliminated a number of those options for universities. So I would expect to see a shift toward more administrative records where that can happen as one change, and that may be a good thing that's coming out of this.
By the way, Katie just posted a poll asking for you to vote on topics you'd like to see us address in the future in this seminar series. So if you can take a moment or two, listeners, and vote for one, or I believe you can also, no, I guess you can. If you want to nominate a new topic, you can contact us directly. So what about the 2030? I mean, can you ever imagine the 2030 census relying upon like big data, to infer? I mean, would that be a good idea? What are the potential biases and drawbacks of that? Like for right now, as a transportation researcher, we work with things like streetlight data, transit data. These are all third-party apps that are collecting data, a lot of it based upon cell phones, and we usually use it at a very aggregate level to protect privacy. Are these potential sources for conducting the census in 2030?
I would be surprised if that case arises, given that in 2020 the main focus became differential privacy as a way of combating some of the potential risks. And Aaron was exactly right that the simulated kind of hack event was mostly focused on was maybe not as real world of a scenario, but I think it'll depend on how things play out with differential privacy, whether or not we would see any sort of big data solution in the future. My main hope for 2030 would be that the exacerbation of an existing digital divide that has really come into clearer focus with the COVID-19 crisis will actually lead to infrastructure solutions that will allow the internet access barrier to hopefully be overcome in the next 10 years. That won't remove barriers about things like trusting government, but at least technologically, we as a nation could be doing a lot better job at serving those currently underserved populations and making their responses easier by providing rural broadband and better technological access.
Well, some of the answers to our census challenges are outside the census, is what you're saying. They're more general challenges. There was a question
I think,
from the audience.
yeah, and I think
sorry, go ahead, Aaron.
Yeah, the question about big data, I think it is less likely that third-party providers of data or aggregators of data would be utilized. But when we think about it, and frankly, where some of those third parties are getting data, some of the big data, the largest big data holders are federal and state government sources. As an example, in preparation for the census, something that most folks don't ever even see is we go through a process called LUCA, which is the Local Update of Census Addresses, where communities are asked to provide every single address that exists in their community so that the Census Bureau can verify the records and know who to mail to. So some of this information is already being collected behind the scenes and used to help ensure that the census reaches everyone. I could absolutely see the expansion of that. And there have already been some questions raised. You know, if we're already collecting all these addresses, and in a lot of cases we have a good sense for who lives there through other administrative records that are already maintained by the federal government, can we utilize some of those federal data sets? Obviously, needing new guidelines around privacy, how that data is protected, and how very specific guidelines on how it's used. But I think there are already conversations or questions being raised about can we do some initial data collection or outreach that way, and potentially use the survey or follow up essentially as validation or getting folks that for some reason think aren't captured in that way.
So there's a question from someone in the audience about whether or not I think what they're saying is that do we get a do-over? Can we do a second census to check if we find the first census is inadequate as a way of checking for accuracy and consistency, or is that just completely illegal or politically impossible?
It doesn't appear that anything is politically impossible these days.
Yes.
It would probably take a successful lawsuit that demonstrates that for some reason the current census is invalid, and at that point it would be most likely the Supreme Court ruling that that's the case to move in that direction.
Oh, that should go well. Any last comments? We're in the last just 3 minutes of our webinar. Any of the panelists would like to just wrap up with a quick summary comment? I'm going to put you on the spot. Let me start with Glennon. We haven't heard from you in a little bit. Give us your bottom line in this discussion.
Census data is critical for research. I mean, especially American Community Survey. That's what most of us rely on to understand what's happening in communities at, as close as we can get to the neighborhood scale or the census tract level, right? And, so please participate in the census. But, I'm deeply concerned about, particularly immigrant populations right now and other homeless and other really hard to reach populations in terms of this 2020 census in the county. And I also, I'm an advocate for the long form of the census, if you haven't figured that out by now. If I'm going to ask every person in the country to fill out a survey, I'm going to put as many questions on it as I can and get the most accurate, best data ever. But that's just me. I would love to see us go back to that. I love ACS as well. I love having data, every year. But I also like that. I'm a supporter of keeping those in the long form as well.
Josh, what's your take-home message? 1 minute or less.
Yeah, I mean, just to echo what Glennon said, I think the most important thing is participation, and for those of us who are already able to participate, to spread the word, check in with family and friends to ensure that, regardless of if they're in Ohio or somewhere else, that they've completed the census. If they, have questions about why, hopefully a little bit more now about the importance of it, not as just a research tool, but as a tool of democracy. And the big thing is that, when a population is undercounted, or a particular group, it doesn't just affect that group. It's not something that we can say, well, that doesn't affect me. I mean, it really does. All of these things come down to the funding, the representation that you and your community are going to get, regardless of which particular group may be undercounted or overcounted.
Great, thank you. Aaron, bring it on home for us.
Yeah, so I would echo what Glennon and Josh said. It matters now. So this wasn't just a push in April. The one date I held back before that I will mention now is the response window has been extended to October 31st. So there is still time to respond. There is still a need to respond. So talk to your friends, your family, your colleague. Keep getting word out that people need to respond to this. It's really important. To help with that, I mentioned earlier that we're developing a resource. There is response mapping available on the Census Bureau site. One of the things we've heard from communities is that it can be a little hard to compare different tracks to each other and kind of see what's going on in your community. So we're developing a dashboard that will allow you to take a look at tracks in Central Ohio and compare them to one another and see how they're doing all in one place. It should be up on our website. Again, that's morpc.org/data. It should be up there next week. To allow another way to look at that response rate data. But for the time being, I would send you to the Census Bureau response rate mapping, and you can just type that into Google and it'll come up as the first thing. It's really great. It's a good resource, and see how your community is doing, and get the word out and push people to respond.
Okay, great. Aaron, Josh, Glennon, thank you very much for participating in today's panel. Audience, thanks for being here, and we'll see you again on June 12th for a panel discussion on the economic impacts of COVID-19. Thank you all. Have a good weekend and be well. Thank you.
Thanks.